The saint for parish priests. Today the church remembers St. John Vianney, a priest known for his faith and help for the poor. In 1929, Pope Pius XI named him the patron of parish priests worldwide. Welcome back. I'm Wyatt Goolsby in for Lauren Ashburn. President Trump's Drug Commission is asking the Commander-in-Chief to declare a national emergency to deal with America's opioid epidemic. Our next guest has outlined recommendations to the President's Commission to combat the crisis. We welcome in Dr. Anand Parekh to the program. He's the Chief Medical Advisor at the Bipartisan Policy Center and previously served as the Health and Human Services Deputy Assistant Secretary for Health. So do you believe, first off, that this is a national emergency?
It is an emergency in the sense that 30,000 Americans are dying each year because of opioids, and 2 million Americans are addicted to opioids. This is affecting rural Americans, urban Americans, rich and poor Americans, young and old Americans. So it really will take all of us together to really conquer this epidemic.
Now, you had put forth some recommendations to the Commission. What kind of things did you specify?
So our Bipartisan Policy Center has a Governor's Council made up of former governors, and they really felt they needed to weigh in on this important topic. And they made 4 critical recommendations. The first, that we need to curb unnecessary prescriptions of opioids in this country. We prescribe way too many opioids for too long of a duration, for too high of a dose. Second, we need to curb illicit supply. So there is an illicit supply coming from Mexico in terms of heroin, synthetic opioids like fentanyl coming from China. We need to curb the illicit supply. Third, we need to treat Americans who have addiction. And unfortunately, out of the 2 million, only 10% of Americans are being treated. And fourth, we need to educate Americans about the state of this epidemic and raise the national consciousness. Those were the 4 critical recommendations.
And when one of those recommendations, talking about the drugs that are coming in from outside the country, it's interesting because Attorney General Jeff Sessions announced this week the Justice Department will be dispatching 12 federal prosecutors to cities focused exclusively on this issue. Can law enforcement, do you think, can really play an important role here?
Law enforcement can play an absolutely critical role in stemming the tide of illicit opioids that are coming in from overseas. The Customs and Border Protection in this country, they need the tools, the technology to identify shipments of illicit opioids coming in. What the Attorney General did this week also is focusing on those very few healthcare professionals out there who are illegally profiteering, perhaps, from opioids, these pill mills. And I think with that respect, that initiative could be very helpful. But it is important to remember why most healthcare professionals out there, it's not that they're illegally profiteering. They just need help, support, and education to make sure they're not unnecessarily prescribing opioids.
A lot of important steps, and it will take a while to do, but those sound like good recommendations. Dr. Anand Parekh, Chief Medical Advisor for the Bipartisan Policy Center, thanks so much for your analysis.
Thank you so much.